Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 014. A 3-year-old boy with pronounced hemorrhagic syndrome has no antihemophilic globulin factor VIII in the blood plasma. Hemostasis has been impaired at the following stage: A. Blood clot retraction. B. Conversion of fibrinogen to fibrin. C. External mechanism of prothrombinase activation. D. Internal mechanism of prothrombinase activation. E. Conversion of prothrombin to thrombin. Intrinsic pathway. Contact activation pathway begins with the activation of the factor XII, a zymogen, inactivated serine protease, which becomes factor TIII, activated serine protease, after exposure to endothelial collagen. Endothelial collagen is only exposed when endothelial damage occurs. Extrinsic pathway. Tissue factor pathway is to generate a thrombin burst, a process by which thrombin is released very rapidly. Factor VIII circulates in a higher amount than any other activated coagulation factor. Common pathway begins at factor X, which is activated to factor XA. It goes on to activate factor E, prothrombin, into factor IIA, thrombin. Also, factor XA requires factor V as a cofactor to cleave prothrombin into thrombin. Factor IIA, thrombin, goes on to activate fibrinogen into fibrin. Thrombin also goes on to activate other factors in the intrinsic pathway, factor Xi, as well as cofactors V and VIII and factor XIII. Fibrin subunits come together to form fibrin strands, and factor XIII acts on fibrin strands to form a fibrin mesh. This mesh helps to stabilize the platelet plug. The answer is D. Internal mechanism of prothrombinase activation.